Dear friends, as a respiratory care physician, it's my moral responsibility to educate you, to make you aware about certain things about Delhi NCR weather conditions. I could see in my clinical practice that a lot of anxiety and apprehensions going amongst the people at large. To a certain extent, I hold these media people and this small time information delivery system responsible for all those myths and misconceptions. But let me tell you, not to get panicky about it. Every year the weather gets back to worse because of so many reasons. First of all, you have to understand why the weather gets bad and what we should be doing it and who are the people at risk and what are the preventive steps to be taken. Now, first of all, let me explain you why the weather gets bad from September onwards. Primarily for the four reasons: because there's a drop in temperature, the wind speed comes down, a lot of man-made activities go up because of festive reasons, and stubble burning. Now, what happens throughout the year? There are certain primary pollutants in the atmosphere, what we call the sulfur dioxide, the nitrous oxide, the carbon monoxide, the particulate matter, what you call SPM, and ozone. These always been there throughout the year. But what happens when the temperature comes down, coupled with the low wind speed and stubble burning? What happens? A lot of these primary pollutants, they come down, and you tend to breathe at a high intensity of these pollutants. More importantly, what happens is primary pollutants, especially there's nitrous oxide and the and the sulfur dioxide, because of the little moisture in the weather, and of course you get these erratic rains. The water and this nitrous oxide and sulfur dioxide, they combine to form some secondary pollutants, what you call sulfuric acid and nitric acid. This is what you call acid rain. So overall, you have a little acid rain, primary and second pollutant, and that's why you tend to inhale a lot of toxic things in your respiratory system. So not to get panicky about it. Yes, we need some legislation, we need political will, we need conscious citizens, we need to take an initiative to take care of our environment, all those things which I keep talking about. But more importantly, if you follow, I think you should be safe. As I told you, since the weather comes down and there's a low wind speed and you're inhaling a lot of pollutants, so it's very important that when you're getting a lot of these suspended particles and the secondary pollutants get in your system, you need to cleanse it on a daily basis. So upper airway cleansing, which is very important. And how do we do this upper airway cleansing? Very simple. This is a simple nasal spray. This is called isotonic saline spray. They are available in the market. So what you have to do, you have to shake well, one in each nostril, you have to squeeze it. That's a very good cleanser. Because what happens when you're inhaling this kind of pollutants, they settle on your upper respiratory, especially the sinus areas, and from there you start getting cough, back pressure, what you call the post-nasal drip and pharyngitis. So this saline spray is very useful. Then of course you take a steam pot, put some tea bag. I always recommend tea is very effective because it's an aromatherapy. It has an antioxidant. You take a lot of steaming, so it cleanses the upper airway. And thirdly, I'm sure you must be aware of, this is called Neti or the nasal wash. Cleansing through Neti pot is very effective. So if you follow 1, 2, 3, the nasal spray, the isotonic nasal spray, the steam and the nasal wash or the Neti pot, you're safe. Because what happens, the pollutant which is settling on the upper airway will not able to go down. So all my friends and colleagues and patients, they should follow this upper airway cleansing. Number 2, since the children are leaving early in the morning for the school, and they should be more careful about doing all those techniques, and at least even if you are not doing about the Neti pot, the cleansing with isotonic saline and the steam is very effective for the children. Children must be doing it. Second, this weather is full of, as I told you, because of secondary pollutants, a little cooling factor in the environment, it acts as a little toxic chamber. And in this kind of chamber, the flu viruses and the the pneumonia, bacteria, they multiply. So I think my humble request to all of this, those who have a little sensitive upper respiratory, or those who have been suffering from metabolic disease like diabetic, or those who have a chronic respiratory like an asthma and COPD, or some immunological disorders, or maybe suffering from or recovered from a cancerous disease, they must get the flu shot every year, and they will take, and this flu will take care of your lot of other complications. So flu shot is a must, and pneumonia shot. Pneumonia shot normally given once in 5 years. So there's a second thing. And the third thing is that do a lot of gargling. The best way to do gargling is a betadine, and iodine gargle is available. Take 1 cap of betadine, put equivalent amount of water and gargle, just hold it and just cleanse it. So gargling. If you are not very comfortable doing a betadine gargle, you can use the tea gargle also. So this airway cleansing, the flu shot, the pneumonia shot, and the cleansing will practically take care of your 80% of the problems. Then of course, as I always tell, that it's not the outdoor which is always bad, it's the indoor is equally bad. Take care of indoor, minimize your carpeting, don't use much of incandescent sticks and jyoth and stuff like that. Stay away from those mosquito coils. Keep your indoor very well ventilated, use a lot of indoor plants. So indoor pollution plays a very important role. So you have to take care of the indoor, minimize your indoor activities. Then of course, a certain disease situation. People, those who have been suffering from those chronic lung diseases, they should adjust, they should visit their physicians, the pulmonologist, to adjust the doses. And those who have a lot of upper respiratory problem, they should take those nasal sprays. What is all the inhalation sprays are available. And also we have a lot of wonderful filters, because N95 filters are available. Now the very safe nasal filters are also available, and of course you can use another very powdery filter called Nasact available. So a lot of filters are also available. So dear friends, if you're following this upper airways cleansing, do regular gargling, take care of your inhalation doses, step up the doses, and go visit your pulmonologist. And of course, there's all those preventive tests which will really help you. But one thing which is very important is the nutrition. So my dear friends, your morning breakfast should be very good. Your breakfast should have a lot of good cereals, high proteins, fibers, and of course, take lots of fresh foods and vegetables. The best thing what you can take, you can have 3 citrus fruits of your choice, like guava is good, the plums and oranges and quinoa, and you can add a little, what you call the apple, coupled with some beet and carrots and tomato. Mix them all and make a little smoothie. This is a very powerful detox, full of antioxidants and full of vitamins. If you have this 1 dose of detox in the morning with your breakfast, you're really protected. So don't press the panic button. Weather is bad everywhere. So take care of your system and take your breakfast well. Take a lot of fresh foods and vegetables. Do all those upper airway cleansing, flu vaccinations, pneumonia vaccination. Step up your treatment. Visit your drugs. Visit your doctors, and all those things which I told you will help you. And of course, don't miss your exercises. Exercise is the most important, which enhance your immune system. Early morning is bad. Probably either if you have time, you can go at after 8 o'clock or 9 o'clock. And but exercise is must. Brisk walking, a lot of stretches, and whatever you're doing is very important. And good sun. Once the sun comes, probably most of the pollutants they go up. So try to avoid going out your walks and all after 4 o'clock, because that is the time again the pollutants go very high. So early morning and the late evenings are bad. So friends, go through this video, take your tips, and if any problem you can text me, and I can always help you out. This is Dr. Bose from SANS Foundation, and you can text me at 98101 59667. I'll repeat, 98101 59667. Thank you, take care, and have a great day.